All right, you guys are live.
Okay, good evening, everyone. This is Sam Tornatore. At this time, I will call the meeting of the DuPage County Board of Health of April 9th to order and ask for a call of the roll. Penny.
Ms. Bottoms.
Here.
Ms. Finch.
Here.
Dr. Hussein.
Here.
Mr. Larson.
Here.
Dr. Munir.
Here.
Dr. Skelton.
Here.
Mr. Spadoni. Mr. Spadoni.
Here.
Mr. Thurston. President Tornatore.
Here.
Dr. Weeks.
Here.
Dr. Wilson.
Here.
Mr. President, you have a quorum.
Thank you, Penny. I understand we do not have any public comments, so we will move on to that portion of the agenda under President's remarks. And as I already did, welcome to the April meeting. We appreciate everyone's flexibility in adapting to these circumstances. And of course, we want to thank Penny and Luke for making sure that this is happening, and I think it's happening pretty well. Also, I have been told, and I guess it's easy to overlook, that this is National Public Health Week. It's the 25th anniversary of that national celebration of public health workers. Certainly, this is a time where public health workers are being appreciated more than maybe they are in other times, but certainly thanks to all of them, and special thanks to our public health workers here at the DuPage County Health Department. This evening, I'm going to be asking for the support of the board to combine the role of secretary and treasurer, and I ask you to support Robert Spadoni in that role. As you know, John Novak resigned as our treasurer because we're somewhat midstream in terms of the election process. And because the treasurer's role is, I don't want to say ceremonial, but a lot of the finances and all of the finances are done by our financial team led by Mike. But certainly I think that having a secretary treasurer is not unusual in most business or entities such as ours. And this will allow us to kind of test this model, and we can certainly revisit it come November when we talk about the 2021 elections, and perhaps at that time we can bring somebody in the role of treasurer as well as a separate person for secretary. So that's going to be on the agenda tonight. I just would ask for your support on that. Finally, the agenda tonight also includes an authorization by our board to transfer $200,000 of the $500,000 that was included in our 2020 budget as a reserve and move it into an accounting unit to cover our initial expenses for the COVID-19 response. And this money was the money that was included in our budget, which accounted for the estimated increase in the property tax revenue for this fiscal year. We're just looking to move that into an account so that we can use it to take care of obviously some additional expenses that we didn't otherwise anticipate given the COVID-19 response. So with that, I'm going to turn this over to Karen and the rest of the team to provide us with a summary of the work that the department's been engaged in over the past month. I think you guys have been pretty busy, and we'd like to hear what you've been doing. So Karen, it's all yours.
Thanks so much, Sam. We are actually now in our 79th day of response to the COVID 2019 at the DuPage County Health Department. Currently, our leadership team has fully activated to not only address the ongoing needs within their areas of responsibilities, the things that we used to do full-time, but additionally to assume responsibilities for this enormous response. As such, we all have specific areas of responsibility under an org chart for this response. and come together daily, typically 6 or 7 days a week, to discuss updates, needs, and goals for the specific areas. In addition to the leadership team, assistant directors, program managers, supervisors, and our amazing public health emergency response manager, Kristen Lundeen, we all work together to make this happen. Now, on that daily basis, as the responses planning section chief, Kristen facilitates these, what started out as in-person meetings and now have turned into calls. And it is using a similar structure that we will be providing our updates to you this evening. So first, we begin our meetings with a situational assessment based on case activity, which is provided by Dr. Chug, our medical officer. In the course of the last 8 weeks, we have brought in 2 additional medical consultants to assist Dr. Chug and her team. Those are Dr. Margaret Kierkegaard and Dr. Linda Hansen, who are now working under Dr. Chug's direction to meet the increased and still increasing needs of our communities. So with that bit of a backdrop, I'll turn it over to Rashmi to provide an update on case activity in the community.
Thank you, Karen. Can everyone hear me?
Yes. That's fine.
Yep. Great, thank you. Good evening. And thank you. As Karen outlined, this has been a very intense time locally, statewide, nationally. So just to start with a brief overview, nationally, the case counts continue to rise exponentially. As of this evening, we're at 465,000 plus cases, including 16,548 deaths. So very sobering counts here. Statewide, as of this afternoon, we're at 16,422 cases. That's including 528 deaths. And at our local county-wide level in DuPage, as of this afternoon, we are at 931 cases. That's including 34 deaths, tragically. For some perspective on how we're comparing activity level-wise, we are looking at rates. So basically the number of cases per 100,000 population. In the U.S., we're at 131 cases per 100,000. Statewide in Illinois, we're at 119, so just under the national level. And then in DuPage, we had been just earlier this week in the 70s, 80s, and now we're at 102 cases per 100,000 population. And then just for a little further comparison, we've certainly been hearing about the epicenter of our national outbreak in New York State. New York City, but broadly speaking, in New York State, their rate currently is 777. So thankfully, we're not there, but we are certainly rising in our activity. That said, we do have, just for some characterization, as you're likely seeing in our daily updates, we break it down by our overall count, which again today is at 931. And we do have within that 931, 130 that are outbreak associated, and that includes associated with long-term care facilities. We now have a total of 17 long-term care facilities. You're likely aware of the initial long-term care facility outbreak that occurred in Willowbrook. But since then, we've had 16 additional long-term care facilities, not necessarily of that magnitude because they didn't have the all-resident testing that was conducted by IDPH at the initial, during the initial investigation, but certainly still, we know this was somewhat anticipated, and we've been responding in a very close, coordinated, and collaborative manner with our long-term care facilities, providing them with pretty much real-time phone consultation. Sometimes initially it was on site with our team, but with an ongoing basis, really multiple times a day by phone and email, and with resources from the federal, from CDC, from IDPH, and then certainly some resources that we've customized and created for them. And then we've also expanded our outbreak to other congregate settings, whether it's workplaces or we've had one or two childcare settings and churches and convention-associated, and even a hotel that was outside of DuPage, but other healthcare settings as well. So we continue our, big team effort and doing the best we can to keep up. And with that, and I did want to mention also, there's an early release in the CDC's journal, Emerging Infectious Diseases, that helps to characterize the really rapidly changing and dynamic quality of this outbreak. So the R0, as you may have been hearing, which is the count or the number that helps to characterize how many people one person can infect. Basically, if one person is infected, how many people does that person transmit COVID-19 to? And several weeks ago, I think it was in late February, the R0 figure was thought to be around 2.5. And now we're seeing that it's actually greater than 5. It's close to 6. And in order for this pandemic to kind of burn out, we need that R0 to come down to about 1. And so we've got a ways to go since we're clearly not at our apex, per the projections and the modeling that we're following. And they are just projections and estimates that continue to be informed by data. But we anticipate peaking in Illinois in the next week. I believe it's currently anticipated for Sunday, April 12th, and that was moved up from April 17th, I think. Again, it depends on the model that you look at, but of the ones that we've been following, it appears to be sooner, and we certainly are experiencing an escalation in our activity. So with that, I'll pause for questions or comments, suggestions. Karen?
Sure. Do we have any questions for Rashmi?
Yeah, this is Charlie. And have we had any on our property or properties that we were responsible for as the Board of Health?
So we have had reported cases of illness, and actually, as you may have seen in the guidance by Centers for Disease Control and Prevention and IDPH, testing, partly because it's been so limited and we don't have the same kind of point of care testing like we do for influenza or for, group A strep or strep throat. The testing priorities have been for hospitalized patients, those that are most severely ill, and for persons either residents of or staff of congregate settings, or these settings that are at high risk for efficient rapid transmission and often have or house populations that are at high risk for complications, such as a long-term care facility or a correctional facility or a homeless shelter. So that's been the priority for testing. So persons who have mild infection or mild illness have really not been encouraged to get tested. Even if they see their physician, often the physician will recognize that this is COVID-19-like illness in the absence of any other diagnosis. So they are appropriately being managed as COVID-19-like illness. So to my knowledge, we haven't had any confirmed cases, but we have had more than a handful of COVID-19-like illness that we have been managing with appropriate isolation and quarantine and work restriction measures. So I hope that helps answer your question.
Yeah, that's fine. Okay.
Yeah,
Dr.
Larry
Shelton?
Shelton here. Yeah, thank you. I have two questions, Rashmi. One is similar to that. With the scarcity of testing, how can we compare, the number per 100,000? I mean, it seems that would be woefully underreported. Or are we included presumed cases? And the other question I have for you,
go ahead.
The other question is, you made comment on the Abbott rapid test. I'm understanding that there's concern about false negatives with that test. Will that complicate our management?
Right. So, yeah, thank you for the questions. The first question is that, yes, and I should have qualified this early, excellent point, that the counts that we're receiving actually only reflect lab-confirmed counts or cases. So you're right. Not only is this not capturing all the people who have not been tested, but all the people, all the ill individuals who have had mild illness who either have or have not presented for medical evaluation. So yes, due to underreporting and under testing, our case count is probably, a fraction of the actual activity that we're experiencing. And to your other question, and I will say that generally we're not like isolated cases of possible illness, so not the lab confirmed. We have confirmed cases and possible cases. The confirmed cases are not, the confirmed cases are the ones that we're tracking and investigating formally. And then there's the possible cases. If they occur individually, then we're not tracking those, within our surveillance systems. But if we are, supporting investigation of an outbreak, then we do track the confirmed cases and the possible cases because we want to make sure we're capturing the magnitude and degree of ongoing transmission related to the outbreak. And then for your second question, I'm sorry, please remind me what was, about the Abbott test, the rapid testing. Yeah, we've heard, I don't know specifics, I haven't seen numbers, but we have heard some concerns and complaints about, problems with the Abbott test. But I think at this point, so diagnostically, it's important to have ideally, high sensitivity, high specificity tests available. But I think what we're eagerly anticipating, and IDPH Lab is actively engaged in identifying the best tests or tests for antibody testing. And we anticipate that in the coming weeks to be hopefully widely available to help determine who's potentially been exposed and or infected with this, and basically who's immune. And I think that'll help not only with short-term assurance, but even with long-term reintegration into activities, whether it's at a small group level or even just, public transportation or, reopening large events and things like that. So I think diagnostically, the PCR testing is still very important, but I think what we're really eagerly anticipating is the antibody testing. I hope that answers your question.
It does, Rossi. Thank you much. And I want to thank you for your tireless effort and your skills in handling this. We're very honored to have you and your team helping us in this pandemic fight. Thank you very much for your work.
Thank you so much. And really, this wouldn't be possible. Everything we're doing has been such a team effort, not only our communicable disease and epidemiology team, but our leadership team and really broadly our strike team members and our assistant directors and supervisors down to our front line. And I have to give a shout out to our emergency call center because the volume of calls has been so immense that we would not be able to even, respond on a day-to-day level if they were not providing the support that they are at the call center. So really, it's been a huge team effort every day, every hour. So thank you for your recognition and appreciation on behalf of the team.
This is Lanny Wilson. I second Larry's emotion, and I want to thank you all. These daily briefings that Penny sends out, the DuPage County COVID-19 case briefing, they're really very helpful. I just my question is kind of a procedural one. Is the DuPage County Health Department for this region the central reporting area, or do you get your information from the Illinois Department of Public Health? How do you get this information Do you have to make calls to the individual testing places and hospitals, or is there a central gathering place where all this information is fed into?
Right. Thank you. Good question. So the lab reports are fortunately sent electronically to the Illinois Department of Public Health, and then they electronically disseminate those to the jurisdictions in which the patients reside. So that's how we receive the vast majority of our reports, through electronic lab reporting. Beyond that, we do receive some reports more early on, and then still a little bit now, where persons will contact us individually, or many healthcare facilities or workplaces or different settings will reach out directly to say that they've received, or that they have a patient or a resident or an employee or a staff member with illness. So that's what will sometimes initiate the investigation, but by and large, it's been electronic lab reporting where we receive the report, and then they're opened up as a case in our, it's INEDS, it's the Illinois National Electronic Disease Surveillance System, and that's where then it's opened up and then assigned to an investigator, and then a case interview is conducted, and then that's where the contact tracing comes in, where we try to identify when their onset date was. And then now, based on recent CDC guidance, we're going back 2 days, not just from the date of onset, to what their potential exposures were, but we're going back 2 days and then identifying their close contacts primarily, but also others, so that they can at least self-monitor for symptoms. And then if they're a close contact, then they're advised to home quarantine for the 14-day period since their most recent exposure, and self-monitor, and then the actual case is advised to self-isolate at home if they're medically stable, or at the hospital, of course, if they require closer medical attention. So that's kind of the flow. Once the case is investigated, then the data is entered into INEDS, which then goes back to IDPH, and then from IDPH it goes to CDC. So that's how they track that's how our counts at the local level inform the state and national counts.
I like your active involvement. The other question is, I guess the deaths come to the coroner's department, right?
Actually, no. The coroner's office, they do maintain their statistics, and eventually we reconcile with the vital records, the death certificates for our residents. The coroner's statistics, I think, reflect largely, there's a lot of overlap, but their statistics reflect any deaths that occurred in DuPage County, versus ours reflect a death of a DuPage County resident, irrespective of where it occurred. So there's a lot of overlap, but our death data still are dependent on what's entered into INEDS, our surveillance system, typically either by the hospital or the long-term care facility, or sometimes us, based on the information we receive, from a reliable source. And sometimes it is the coroner's office. So we do communicate with them regarding deaths at times. But yeah, that's the differentiation.
Thank you so much. Good answer.
Hi, this is Lori Bottoms. It sounded like the state is sort of turning away or not emphasizing as much testing for the actual disease as they are now turning towards antibody tests. Is that fair to say, or do you know when more widespread testing will be available?
That's a good question. At this point, it's still the diagnostic PCR testing I wouldn't say widely available. That's more available than it was, but still not to the level that I think, again, it's still not that point of care testing that can occur in your doctor's office, like a flu test or a rapid flu test or a strep test. But I think what we're anticipating being widely available will be the antibody testing. I think there's some limited availability of antibody testing, but not by the Illinois Department of Public Health lab yet, and not by most health systems. But we do, and I know they're actively being explored and investigated, and like testing is occurring in the sense of determining, like a lot of analysis is occurring even at the state lab to determine which antibody test or tests they'll adopt. And then, and I think different health systems and hospital labs and commercial labs are doing that as well. So it's not currently widely available, but we anticipate more robust availability and access to the antibody testing in the coming weeks.
Great, thank you. And thank you for all of the work that you're doing with the individuals and businesses in the community.
Thank you.
Thank you. And so as concerned as we are, and as much of a priority as our external response is, kind of to Charlie's point, we also receive updates on the safety, on supply levels, on logistics, on the health and the operational concerns of our internal critical and essential services that we have continued to provide. Now, those broad sets of responsibilities are shared across many of the leadership team, but primarily Andrea Gargani and Lori Carnahan. And so Andrea is going to share information on how we're monitoring our employees, assure that our staff have access to necessary supplies and protective equipment. And then Lori will walk us through the handout that we emailed you this morning that really talks about the program operations that are happening and how they're happening. So with that, Andrea.
Thank you, and keeping them safe. So each day before any staff shift, they are able to log on and complete the self-health screening form. Thanks to IT under Luke's leadership, we're able to do this in an automated fashion. And as soon as those results are in and someone screens positive, so meaning they answer yes to the question of having a temperature, a cough, a sore throat, or other symptoms, that generates an email to myself and a couple other folks on my team, and we're able to follow up with those staff members in real time to make sure that, you know, it could be attributed to some other factor, like someone has seasonal allergies, or they've, you know, sometimes they're not even symptoms related to COVID-like illness. So we're able to follow up in real time and make a determination of next steps for those staff members. And then if someone has symptoms that are COVID-like, they are taken off work for a minimum of 7 days. And the day before they are expected back to work, I reach out to them directly via email or other means in conjunction with their supervisor, service unit director, and our HR department, and again, review their symptoms and ensure that they are indeed ready to come back to work, and then give them instructions on masking, which is less of an issue now because we are masking, staff are masking at the health department. So theirs is just much more specific in monitoring symptoms 2 times a day upon their return for up to 14 days after the onset of symptoms. So that in combination with the PPE and the supplies we have available to ourselves and the staff, that has enabled us to be able to stay at a fairly high operational level, meeting the needs of the residents of DuPage County. So early on, when we started to see that this was coming, we were able to order much of the needed PPE that we felt like was going to get us through. So we have an internal inventory of supplies that our central services, Pat Flaherty, as you all know, and her team have been able to keep track of. And there's a specific approval process for any cleaning supplies and other PPE, just to make sure that it's being allocated in a way of which is appropriate for the services that we're providing, to make sure that we have enough. And then, you know, from there, we've developed along the way with our leadership team and our incident command structure messaging that goes out every day to staff. And sometimes it's instructions on how to use PPE. Sometimes it's how to keep themselves mentally, physically healthy. Sometimes just words of praise and appreciation. So I think that we've been able to, in a time like this, do our best to support folks physically, mentally, and really, I think Karen has done an amazing job as our leader, making us feel like we're all in this and in this together, and that really keeps us going. So if you have any questions, I can take those now. Otherwise, I'll turn it over to Lori.
Thanks, Andrea. So good evening, everyone. This is Lori Carnahan, and I'm just going to take a couple minutes. You should have received a memo this morning, really kind of discussing our current operations. And so from everybody is aware, we drastically altered our services back on March 16th. So that at that time, leadership had to come together and really work together very quickly to identify what services were essential and what needed to remain weeks into this. And we do have over 30% of our staff working remotely. It seems like, we're kind of doing it and everything is pretty seamless, but really wanting to make note that was a very, very large shift in a very short amount of time. So it really took a whole team effort to kind of get everybody up and running, from the, IT leadership, supervisors and staff, to really kind of change the way that they're doing things on a regular basis. So the document is really broken down across each service area and identifies what client consumer services are fully operational, what services have been modified, and what services needed to be suspended. You'll notice many of the fully operational programs are clearly anything in CDFE, as well as our 24/7 operations in behavioral health, including crisis and our residential services. And some on-site services remain at that urgent level of care, such as urgent psychiatric evaluations, injections for long-acting antipsychotic medication, or our Vivitrol for our substance use. TB, we have OB clinics. So there's definitely some face-to-face services happening. But obviously working with Andrea and really kind of making sure that we're putting all of the safety in place for our staff and our clients. And then many of our services across all of our areas have been modified, but are still up and running. They're just running in a different way, and we're offering services over the phone or video. So a lot in behavioral health with benefiting to make sure clients still have access to online applications and things like that, and offering curbside pickup for our WIC clients, as well as Narcan pickup for our community members and first responders through the DuPage Narcan program. And you will also note that we have had to suspend some services during this time as well. A lot of those is, sometimes it really required that in-person, face-to-face interaction, such as our group. We don't really have a platform for group activities, or if they were out in the community at schools. But we're really hoping to get, those services back up and running as quickly as we can once we're at the end of the services, and make sure we're meeting the client needs in any way we can. Again, it's been such a huge shift in service delivery over a short period of time, but I think, and I would think that leadership would all agree that all of, overall our clients and community members really have had very minimal gaps in the services that they depend on every day. I can take any questions? Yep.
Yeah, any questions for Andrea and Lori about kind of our day-to-day operations with our clients and staff?
This is Lanny Wilson. Just a simple question. Those operations that are suspended, I'm sure that includes several health department personnel. Are they being rerouted to help in other areas, or are they laid off for a while? Hello?
Lori, do you want to kind of go through the breakdown? Mm-hmm.
Yeah, so currently we have about over 30% of our staff that have the ability to work fully remotely from home through video and phone and things like that. And then another 40 to 50% that are working their either their full schedule on site in kind of our more 24/7 operations, or a modified on-site remote schedule. So that kind of leaves us with about 20% that are currently not working right now. We have been able to activate some staff into different areas, like our emergency call center, but currently I think we're averaging about 20% that are not currently working at all.
Do those employees, do they file for unemployment, or what happens with them?
At this point, Lanny, this is Karen. At this point, they are getting paid to get into, when we talk about the financial impact of that, we've kind of looked at what it would cost us to lay individuals off, and that's not a zero sum kind of game. Not that it's a game, but it's not a zero. It's not like we completely reduce our costs for those individuals. So they can talk a little bit more about that. At this point, we've been asking people who don't have an assignment to stand by, because it's entirely possible that we will need them back at some point with our services. And we have kind of been letting that be our message to staff at this point.
Okay. Thank you. It is more of a curiosity. There's no judgment there. These are difficult decisions to make, but I just wanted to know procedurally how things were being done.
Employees who are essentially getting paid to stay home. Most of those are folks that we simply do not need to engage their services. And because they're temp or on-call or contractual, it really is having minimal impact on the payroll and the budget at this point.
Thank you.
Any other questions?
Hi, this is Dr. Minier. So I'm general pediatrics, and you're not giving shots, I think, right now to children. Our practice is doing 18 months and under. Are you guys anticipating maybe restarting vaccines for kids who need them, or babies to toddlers?
Hi, Doctor. This is Andrea Gargani, the Director of Public Health, and I'm in contact with Bev Gavednik, our VFC coordinator and school health nurse supervisor. And we are talking about that on a weekly basis, making determinations when it is safe to bring those in. So for our active WIC staff, that is WIC clients, that's something that the staff are evaluating on a week-by-week basis of patients / little people that need to have vaccines, and are reaching out to them to see if they've been able to get into their primary care and that they are getting those vaccines. For the general public, our message has been for folks to follow up with their primary care and to let us know if they're not able to do that. But at this point, because we do give vaccines outside of immunization clinic, we actually give them in quote unquote WIC clinic. And up until this week, there have been staff that were still seeing clients in WIC.
Okay.
We would bring them in on an individual basis if needed for vaccines. So at this point in time, we are monitoring that very closely with especially our WIC population, as well as the general public, giving them the encouragement to also see primary care.
Yeah, we are trying to do 18 months and under, and actually kind of are sometimes seeing that some of the parents of the 2, 4, 6 months don't want to come in out of fear. And we're trying to reassure patients that we are making every effort to not have any safety issues when they come in, and that we still don't want them to get measles and chickenpox and whooping cough and other, preventable illnesses at this point. So thank you for that.
Yes, and on that note, actually, Bev and I have discussed starting immunization clinic back up for just that population and really staggering those appointments to help alleviate the fear for that group. So like I said, right now it's more on an individual basis, getting them in, but we have talked and do have plans when things die down a little bit more to hopefully get that. That would be one of the first things that we get started back up.
Great, thank you.
So if you recall, even back in the early days of our response, actually when we held our February retreat, I mentioned that we were tracking our expenses related to this response. And as our efforts have continued and really mushroomed and increased exponentially, the need for not only tracking expenses, but also monitoring as well as applying for opportunities for possible financial resources have also been expanded. As the financial and administrative lead in our org chart response, Adam Forker can provide us updates with input from Mike Kipp on the areas of revenue that we anticipate being impacted, as well as opportunities for funding through both FEMA and IDPH. So, Adam?
Sure. Thanks, Karen. As you might imagine, we've certainly experienced increased and diverse set of needs related to both personnel and finance as a result of the COVID-19 response. Fortunately, we have two very experienced team members and professionals in these areas, with Natalie Witten as our human resources manager and Mike Kipp as our budget manager. We've been able to really, draw on their expertise and meet the increased administrative demand, despite the many unknowns at this time. So together with them and the rest of our leadership team, we've really taken many actions over the past few weeks to really prioritize the sustainability of both our workforce and our finances. At this point, I would just jump back and clarify to the point about the 20% of the workforce not working. Again, I think Karen mentioned that the majority of that is actually temp, on-call, and contractual. That group of staffing makes up about 14% of that number. So you're really left more like 6% of the folks on our payroll that were not activated or working up until now. But in fact, some of them have actually just received emergency assignments as of today as well. So we're really continuing to make sure that we're tapping the existing resources as much as possible and, minimizing any need to take further action with that, although we are, of course, evaluating and exhausting all of our options. However, at this point, I think it's probably most important for me to turn it over to Mike Kipp, who will walk you through some of the most important related financial details. So, Mike?
Thanks, Adam. Good evening, Board of Health. When we talk about a quick financial update, we were able to close our March period today. So in your board packets, the financial update numbers that I provided were through the end of February. I've got something a little more current as we were able to close March today. And actually, from the budget side, things look very, very good through the first 4 months. Revenue numbers are just over $8 million, and expenses are just over $15 million. And that's fairly typical at this time of the year, as we get our property tax installments twice a year, and those are our biggest infusions of cash. We get those in June and in September. So if we look at the revenue side, we're currently about 1.6 million below our projected numbers for the 2020 budget, which is actually quite good when you look at about 1.3 million of that is from our grants, which is really primarily timing related. So we're pretty much on target with the rest of our revenue projections. On the spending side, we're with just over 15 million, so we're about 14% or 2 million below our year-to-date budget, which is about 1 million of that is from personnel costs. If you compare this year to last year on the revenue side, through March 31st,
Revenue was about 3% over where we were last year, and expenses are about 9% over where we were last year. Now, on the expense side, 9% is a little over $500,000. It's primarily made up of two things. We had a $350,000 computer laptop purchase last month, so that's a big chunk of it. And then the other part of that increase is a big part of that is for the COVID expenses, about $60,000. So from a budget standpoint, we're in good shape, and as President Tornatore mentioned before, for the response efforts, that was $500,000 that we plugged into that cost. Fund balances as of today are also healthy. Our general fund balance of just about $22.5 million reflects an increase of about $3.3 million, almost 17% compared to the prior year. So our general fund cash numbers are up. All fund cash numbers are also up by about $3.5 million as well. All fund cash total as of today is about $30.8 million. So in terms of the budget, in terms of our cash, we're in a healthy state. Now looking forward, fiscal impact of the COVID-19 response, based on what we know today. On the expenditure side, we've spent a little over $500,000 on the response. $450,000 of that is for personnel, and the remainder is for contractual and commodities. Looking at a revenue impact it's a little difficult at this point, but I attempted to put some numbers in the financial update. My initial and very, very preliminary, and I must stress these are potential lost revenue numbers. The number that we currently are looking at is about $1.6 million, and that was detailed in the financial update. And then finally, cost recovery efforts. Just before the meeting tonight, we were notified by IDPH of about $400,000 in funding that will be available to us. We'll be working on that application first thing tomorrow morning. And we've also applied for cost recovery dollars with FEMA. Paperwork with IEMA has been put in, and we're expecting to see those dollars sooner rather than later. And also, not only the cost recovery dollars, but we're also looking at funds that are available to local governments to cover lost revenue, because there are going to be, from what we're seeing, there will be opportunities to address that side of the ledger as well. Are there any questions?
This is Lanny Wilson. So you mentioned the $400,000, and then you mentioned the other two possible revenue sources. What do you think that those might add up to? Just ballpark. I realize that you don't know exactly.
Well, one will, the FEMA numbers will be cost recovery. So the numbers that we're getting with IDPH will cover a portion of our expenses, and I would imagine the remainder would be, we spend $1, we will hopefully recover $1. That's the anticipation.
Oh, very good. So we're talking maybe.
The other side of that, Dr. Wilson, would be also any lost revenue that we can document. We'll be also anticipating that'll be part of some of the remedy, financial remedy that we'll be seeing over the next several months.
Karen had mentioned that you've been keeping track, going back to February, of the hours spent. So is that part of that spend $1, capture $1?
Yes. Yeah, early on we set up a cost center to start capturing what we're spending on the event, and yeah, as I said, today it's a little over $500,000.
Yeah, thank you so much, Mike. Good job.
You're welcome. Thanks.
This is Bob Larson. I do have a question. There is a proposal that's going to be up. It hasn't been formally posted yet, but you'll see it tomorrow by the treasurer about the possibility of not imposing fines for anybody who does not file their real estate taxes between now and September 1. Although something like 40% of those who file taxes or real estate taxes do so by escrow anyway. So my concern with that and my question to you is what our burn rate is over the next 4 or 5 months, and if we do not get if we have a substantial delay in our real estate tax payments, does that put us in a difficult cash position, or are we comfortable until September, even if that happens?
We should be comfortable. We're currently, as of today, if we received not a dollar moving forward and we had a fully functioning operating budget, we take our entire budget and divide it by 12 and say we're going to spend every dollar, we could operate between 6 and 9 months without any revenue coming in. So I'm very comfortable that our cash situation is sufficient to ward off any kind of a delay in receiving the taxes.
Okay, thank you.
Okay, so finally, you might think, what else is there to talk about? But it's my distinct honor to be working closely in this command structure org chart. I have the title of being the incident commander, and then Chris Hoff serves as the deputy incident commander. And what that means in reality is that much of the community-facing response falls on Chris's shoulders. And as luck would have it, he and his wife had their third child, I think, 3 days before we went into our COVID-19 response. So all of young Patrick Hoff's life has been his dad working as really a public health leader and hero on this. So I would like to now turn it over for Chris to talk about our overarching response objectives from a community-wide standpoint that we are addressing daily. So Chris?
Thanks, Karen. Can everybody hear me?
Yes.
Yeah.
Okay.
That's fine.
Great. Yes. Hoping that young Patrick still wants to pursue a career in public health after this. We'll see. But thank you, Karen. And I just wanted to provide you all with some context for our response and then give you an overview of the objectives that we're focused on today. Obviously, those have evolved over time, but we wanted to give you a sense of where we are focusing to support our community. Karen mentioned it early on in her comments, but this is the 79th day of our formal activation to the response. And I just want to pause and point out how unprecedented that is to be activated for this long, and how powerful a team of professionals you have at the health department that have been going at this nonstop 7 days a week for going on 80 days, and to consider the resources that requires. So I want to thank and appreciate all of the health department staff and your support as a board. Thankfully, we do have a robust public health emergency response structure. In a public health emergency, the health department is the lead local agency, but clearly we're not the ones with all the resources or all the controls. We work very closely with all the agencies in every sector of the community. Karen also mentioned that when we activate by principles of the incident command system. So we are scaling up our response and scaling down when necessary. But really, we've been kind of growing since that activation in January. The other unique feature of our response in a public health emergency is that we have, one, the obligation to our organization and to our clients to continue essential public health services. Lori and Andrew talked about those, but we are then also responsible for this community-facing response. So unique in that not every organization has both those functions, and we have both of those responsibilities, which we take very seriously. So we are looking at projections that have us peaking in terms of cases and deaths in Illinois sometime between April 11th and May 15th. And what's probably most important to provide context on as we talk about our objectives is that even when we peak, we will have a long time and a long period of cases and deaths that continue before we're back to any sense of normal activity. So as we've talked with mayors and managers and police chiefs and fire chiefs this week, I think we've taken some by surprise, and we've said when we hit that peak number that everybody's watching very carefully, that doesn't mean we're done. And so we really do have a long way to go. So in terms of our current response, there's a couple of key areas that I'm just going to run through. That these are our primary objectives. One is monitoring and identifying new cases and continuing to investigate those. To the best of our ability, we are following up on every one of those cases to identify where they are, what risk they pose in terms of transition, and helping them safely isolate to break that chain of transmission in DuPage. We're working very closely with long-term care centers and assisted living facilities that pose some of the highest risk based on the vulnerability of those residents. We've pushed a lot of information to them and are really working closely with them to limit the potential spread in those facilities. Also working very closely with business communities and others that have cases to help them contain cases as quickly as possible. When we talk about staff activation, we've pulled 19 additional staff in to support communicable disease and epidemiology in those efforts to identify new cases and monitor existing. The second area is around PPE distribution. We are fortunate in that the county has received supplies from the Illinois Pharmaceutical Stockpile, the Federal Strategic National Stockpile, donations from residents and businesses, and then finally some supplies that are starting to come from the state of Illinois that they've been able to procure. So we've been working since early March to be pushing that material out to first responders, hospitals, long-term care facilities, funeral homes, hospice providers, anybody out there that is providing a response to patients who may be ill, in the aims of keeping those staff safe and continuing to work, and in the aim of trying to reduce the transmission of disease in the community. And we're working very closely with DuPage County Office of Emergency Management and Homeland Security to do that. The third area is ensuring ongoing communication and outreach to our stakeholders. We have weekly meetings and updates with the mayors and managers, police chiefs, fire chiefs, hospital emergency preparedness, and hospital senior leadership, really trying to provide consistent, updated information to help them make decisions, know what's going on, and be prepared to take actions when cases are identified. We've had fantastic participation from all of those sectors and all of those leaders. We've been pushing out a weekly newsletter, daily updates to the media and to stakeholders. We've increased our social media and web presence and seen dramatic increases in the number of website hits, the number of followers on our social media channels, and engagement through media. So we've been trying to really talk about what we're doing and what people can do to keep themselves safe. Fourth area is around school coordination. Thankfully, this has tailed off a little bit as the school closure decision happened in March. But prior to that, we had been intensively working with schools on cases in their communities as well as school closure decisions, and are starting to work closely again with the Regional Office of Education for what comes next after April 30th. Fifth area is around our own internal business continuity. We've talked about that a little bit already, so I won't go into detail there. Sixth area is around supporting hospital alternate care facility capacity and planning, working closely with healthcare facilities to ensure that they have adequate supplies and plans in place for handling surge, and looking into options in the community to provide surge facilities and connections to state-level planning on these facilities you're hearing about, McCormick Place, Sherman Hospital, Westlake, those facilities. And finally, our last area is really around supporting first responder alternative housing. This week, really, we've done a lot of work trying to identify facilities and spaces for first responders and other critical infrastructure staff to safely quarantine or isolate away from family to ensure that they're able to do the critical jobs that they provide in the community. So those are the key areas that we're focused on this week. Those objectives have changed over time. Happy to take questions and happy to provide updates whenever it's needed. Thanks.
Questions for Chris?
This is Lanny. This morning on TV, I saw that there were mobile homes being provided to a lot of docs and first responders around the country. Is that part of what you were talking about, Chris?
It's something we've considered. I don't think we've activated those at this point. Right now, hotels have really been fantastic in stepping forward to offer their services. Clearly, they've been impacted by the dramatic decrease in travel and entertainment, but primarily that's hotels and universities and the places with housing that have offered space for healthcare workers and first responders.
Yeah, good point. Okay, thank you.
Okay, well, as you can see, this response is massive, comprehensive, and truly at its core, it represents the reasons that each and every one of us on the, we call it hashtag Incredible Team DCHD, are so proud and pleased to be local public health practitioners. These truly are times that none of us or members of our communities have experienced before. But it is truly a blessing to have the support, understanding, and the existing relationships that assist us in continuing to address this concern for the foreseeable future. Any questions on our response? Thank you so much, and back to you, President.
Well, thank you, Karen, and thank you all for that very thorough update from all points of view. I certainly echo what everyone else has said. We're extremely proud of all that you have done and the sacrifices that you've made and the risks that you take on a regular basis. It's not something that we take lightly, and to all of you who have done so well and continue to do so well, my thanks, as well as the thanks of the board. Moving on, we'll go to item number 5. I will entertain a motion to approve the minutes of March 12th, 2020.
So moved. This is Bob Larson.
Second. Mindy Finch.
Okay, there's a motion and a second. Any additions, corrections, or deletions from the minutes? There being none, all those in favor signify by saying aye.
Aye.
Aye. Aye.
Any opposed? There being none, the minutes are approved. Moving on to the Treasurer's Report of February 29th, 2020. Mike, you want to take us through that, please?
Absolutely. Thank you, President. As of February 1st, the Health Department General Fund balance totaled $23,440,061.15. Receipts for the month totaled $3,055,783.17, and disbursements totaled $2,985,471.68, leaving a month-end balance in the Health Department General Fund of $23,510,372.64. Combined balances in all 4 department funds totaled $32,294,664.54. Receipts for the month totaled $3,065,497.22, and disbursements totaled $3,375,116.09, leaving the combined balances in all 4 funds at $31,985,045.67. Investment earnings recorded to the general ledger in the month of February for all 4 health department funds totaled $37,541.03. Including the February earnings, year-to-date investment earnings in all 4 funds totaled $115,033.
Okay, thank you, Mike. Any questions of Mike? Any comments? There being none, I'll entertain a motion to approve the Treasurer's Report.
Bob Larson, so moved.
Second. Mindy.
The motion is second. All those in favor, please signify by saying aye. All transactions, consent, those items. Entertain a motion to approve that item.
So moved by Bob Larson.
Second. Mindy Finch.
Any discussion? Any questions? All those in favor, please signify by saying aye.
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 Any opposed? And the motion carries. Moving on to our action items, we have a Resolution 8-1. This is the Families First Coronavirus Response Act. I'll entertain a motion to approve that resolution.
So moved, Bob Larson.
Second. Mindy Finch.
The motion and a second. Karen, does anyone have any questions or comments regarding this? Okay. All right. There aren't any. I guess we can move forward then. Motion and a second. All those in favor, please signify by saying aye.
Aye.
Any Any opposed? And the resolution passes. Moving on to item 8.2, the sick time policy change. I'll entertain a motion to approve that as well.
So moved by Bob Larson.
Second, Mindy Finch.
Motion and a second. Any discussion? Any questions? Comments from staff? Okay, there being none, all those in favor, please signify by saying aye.
Aye. Aye.
Any opposed? And the motion carries. This time I'll entertain a motion to nominate Robert Spadoni for the position of Board of Health Treasurer through the current term of the officers.
So moved by Bob Larson.
Second, Mindy Finch.
Motion and a second. And for those of you who are wondering why we're doing this, of course, we had the resignation of John Novak at the last meeting. The office of treasurer is currently vacant. We do have the right under our bylaws to fill that new officer at any meeting in the Board of Health. It was a thought of some of us that the role of secretary treasurer would be best served by or the role of treasurer would be best served by a board member, and that in order to avoid any disruption in what we're doing, which essentially is what Mike's been doing since John left, is to combine the offices of secretary treasurer, and that's why we have this motion in front of us. So if there are no further questions or comments, there's been a motion and a second. All those in favor signify by saying aye.
I don't know, do we need a roll call on this one, or?
I don't know if we do, but let's go ahead and do it. We haven't done one, so go ahead, Benny.
Mr. Larson.
Aye.
Now we know why you wanted a roll call. Okay.
Okay, Dr. Munier,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
I guess I'll vote for myself, yes.
President Tornatore,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Dr. Hussein.
Yes.
Mr. President, the motion carries.
Thank you. Congratulations, Robert. You have another office. We're very
What a deal. Awesome.
Okay.
I was really trying to give you an opportunity to vote no.
Moving on, item 8.4, budget transfers. I'll entertain a motion to approve the budget transfer set forth in your packet.
So moved by Bob Larson.
Second, Mindy Finch.
Okay. Karen, you want to just take us through this one real quick, or Mike, either one of the two of you, just to explain it, since we're dealing with a couple $100,000 here.
Yeah, this was,
Mike?
Sure. This was part of the 2020 budget process, was the approval of the 500,000 additional tax levy. We put this aside in the budget reserve cost center to be kind of just set aside for to be determined how to be used. By we told you we were going to come back to you and ask for your approval on utilization of these funds. We have been borrowing dollars from other operating units and in order to fund the response so far, and this is our ability to utilize those contingency dollars to support the response efforts.
Any questions of Mike on this or comments? Okay, there's been a motion and a second. Roll call, please.
Mr. Larson,
Aye.
Dr. Munier,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Dr. Hussein,
Yes.
President Tornatore, the motion passes.
Thank you. Moving on to item 8.5, grant acceptance. I'll entertain a motion to approve a grant from the Illinois Department of Human Services for outpatient fitness restoration to behavioral health services in the amount of $6,080.
So moved by Bob Larson.
Second, Mindy Finch.
Okay. Any discussion or questions on this item? Being none, all those in favor, please signify by saying aye.
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 Any opposed? And the motion carries. Do we have any unfinished business? Any unfinished business? Do we have any new business? Anyone wish to bring up anything before the board? Okay, there being none, our next meeting, God willing, will be May 14th, and hopefully we'll be able to see each other, not on Zoom, but in person. We can hope. And with that, I wish all of you a wonderful holiday season, no matter what your religious belief, or if you have none, have a wonderful Sunday. But in any event, I'll entertain a motion to adjourn.
So moved.
Second.
There's a motion and a second. All those in favor, please signify by saying aye.
Aye.
The motion carries. We are adjourned. Thank you, everyone. Be safe. Be healthy.
Good evening. Thanks.
Thank you.
Thank you.
Thanks.
Bye.